Hi class! In continuation with community health nursing, this week we are learning more about the impacts of health disparities. According to the Office of Disease Prevention and Health Promotion's Healthy People 2030, health disparities represent disadvantages that certain groups of individuals experience due to a variety of factors. These factors include, but are not limited to, income, housing, race or ethnicity, sexual orientation, and age. Health disparities are linked to gaps in care that are essential to assuring appropriate health treatments and completion of preventative measures. In the United States, many people are facing hardships trying to cover costs of healthcare and are opting out of healthcare treatments altogether. The following discussion will address the health disparity of socioeconomic status in relation to healthcare costs, how this impacts healthcare, and how this can be improved upon or addressed. According to the Kaiser Family Foundation, or KFF, approximately half of U.S. adults have some difficulty affording healthcare costs, with minority groups reporting an increased financial burden. From the KFF, approximately 60%, or at least 6 in 10 Black adults and 65% of Hispanic adults report difficulties affording their health care, compared to 39% of white adults. Another troubling statistic from the KFF is that 1/3 of adults reported either they or a family member had skipped recommended medical treatment due to cost. Unfortunately, patients experiencing financial struggles are often discriminated against in the healthcare field. From our community public health nursing textbook, healthcare funding relies heavily on Medicare and employer-provided insurance, meaning these patients are generally treated better than those with Medicaid or lower socioeconomic status. When patients feel neglected by their healthcare team, they may decide to discontinue any medical treatments. When patients do not adhere to prescription or prescribed medication therapy or medical treatment, their health condition is more likely to worsen. Despite efforts to avoid medical costs, these patients generally end up requiring advanced medical services due to the development of comorbidities, in turn increasing healthcare costs. According to the American Heart Association, racial health disparities resulted in approximately $93 billion in excess medical care costs and $42 billion in lost productivity each year. In order to improve these disparities, healthcare professionals must become culturally aware and work to reduce discriminatory behaviors within their practice. To improve the relationship between healthcare providers and the community health education activities could be arranged, or the team could collaborate with faith-based organizations to spread educational services. According to a journal article within Clinical and Translational Science, health professionals that actively engage with members of their community are more likely to impact change behaviors, potentially lowering the barrier between healthcare and patient adherence. Thank you.